Hey everybody, I'm Andrw Salciunas of 97.5 The Fanatic. Of course, you may know me better as the Chunas. So you hear me every day, 10 to 2 with Anthony Gargano, Sunday mornings with my man Jamie Lynch. So whenever you tune into The Fanatic, there's a good chance that you're listening to me. But today we're not talking about sports. Today we're talking about something that's really cool. And I got Dr. Vivek Sailam here, a cardiologist at Virtua Health. And we get to talk about stuff that seems like wherever you look, somebody has one of these, and it's smartphones, it's smart watches. And it's a way for us to not just tell time and not just look at Twitter like I do mindlessly every single night, but it's also a way for us to check our health. So, Doc, I want to welcome you in today. Thank you so much for joining me. I absolutely love doing these interviews because I learned so much more for myself. So, Dr. Sailam, let's talk about these smart watches, these fitness and activity trackers. What are the benefits that we get out of them?
So I think that these fitness and activity trackers, just like you said, have really taken our society by storm in recent times. I use them myself, actually. I have an Apple Watch, and there's many different brands on the market right now. The main thing that I think that people should be engaging them for is to kind of track their activity and give them a gauge of how much activity they're really doing during the week. A lot of my patients come to the office and they say, well, I'm not losing weight. I'm eating okay. But these watches give us some concrete data on how much you're walking, how much you're sleeping, what your heart rate's doing, and in some cases, what the oxygen levels can be for people during the day also. So I think it's a great piece of data that you can analyze over the week, and there's summaries that are printed out and given to you to give you a sense of where you are.
I can tell a personal story. I know somebody that actually had SVT. She went and got it taken care of, and she caught it on her Apple Watch. And that's one of the other perks, right? You can catch your heart rate in real time and go, oh, wow, I need to get this checked out.
Absolutely. And one of the things that happened back when the Apple Watch 4 was introduced is that they got FDA clearance for heart rate monitoring and detection of irregular heart rhythms, such as atrial fibrillation. So for my patients in particular, I've suggested to them that definitely these are not medical grade devices, but they are used to detect severe rhythm abnormalities. So I tell my patients that, listen, if you're watching TV and your heart rate's 150 and you're not doing anything, we've got problems. If you're watching TV and your heart rate's 40 and you're just sitting there and you're starting to feel dizzy, we have problems. And the nice thing with some of these newer models that are out is that they can detect atrial fibrillation, which, as we know, is a very irregular heart rhythm that can potentially cause a stroke. So the abilities for these watches to detect these items and to give people an idea that there's an issue with their heart rhythms or heart rates is very, very important and very clinically useful.
Now, back in the summer, there was a big talking point when it came to the iPhone 12 and its way of tracking all these different sort of health scenarios. What was the big topic that was going on this summer?
In the summer, I think that there was issues with some of the claims about blood oxygen levels and some of the irregularities with people when they're exercising. I think, in my opinion, like I was saying earlier, that it's really important that these devices have to be used for some very broad bulk data. You can't use them specifically for medical grade decisions, but they can give us a broad sense of what's happening with people with their heart rates and with some of the issues that they may have from a medical standpoint.
Now, what other kind of things should we look at, right? So there's other things to be concerned about, right? Because you keep on mentioning it. It shouldn't be the overall tool. It should just maybe be used as a cause for concern to go get checked out. Is there other sort of concerns we should use by not just living by the smartphone or the smartwatch?
I think that you have to correlate, a lot of the data that you get on the watch with some of your clinical symptoms. So, I get patients all the time that come in, they say palpitations, they feel like they're having racing heart rates, or they feel dizzy. So we have to correlate those symptoms with the actual concrete data that we find on these watches and obviously get them corroborated with a medical grade investigation also with the devices that we use in our office. But symptoms and some of the data have to go together with making a diagnosis for some patients. So I use the data a lot. Like I mentioned earlier, I have an iPhone and an iWatch. I have the version 7. So I personally track my own data with this during the week in terms of activity levels and heart rates, but you have to really correlate these with the patient specifically with their symptoms too.
Doc, thanks for taking the time with me today. I know I learned a lot. I hope you watching learned a lot as well. But if you need more information, you can check out virtua.org/heart consult. And Doc, if we go to that website, what can we learn?
Well, you can learn about all the different services provided by the hospital system, the type of diagnostic capabilities that we have at Virtua as a whole, and how we can make you feel better and live longer. That's basically what you're going to see on that site. We have a tremendous resource. We have the largest cardiology program in the region. So I think it's a very informative site and a very informative resource for your health overall.
Doc, I really appreciate you taking the time with me this morning. I had a lot of fun, learned a lot, and I hope everyone else did too. And if you guys need any more information, make sure you visit that URL. It's virtua.org/heart consult.